Hey everybody, welcome back to session 2 of Eye on Mental Health, January 2025. Can't believe we're already in the new year. Thank you guys so much for joining us for our next session. You guys, I'm so excited for this session because this is going to be the session where you get to hear from some long-term survivors with ocular melanoma. I put out a call months ago just asking for okay, I want to know all of the people in our community who are here on social media who have been around in the ocular melanoma community for a long time, right? I'm looking for people who are 10 plus year survivors or who are currently living with metastatic disease and they're more than 5 years into a metastatic journey. So I have found so many of those people. I've had people coming out of the woodworks. If you missed our podcast episode that we had the last little while, but it was about a panel of long-term survivors. And I had 4 patients on there who just share all about how they have been living with their ocular melanoma diagnosis and kind of where they are now. And we just talked a little about this emotional journey and the mental health supports that they had, all of those pieces. So it's pretty incredible. And I am so excited to bring on our panelists. Okay, so just by way of introduction, I have Gayla Timm and I have Justa Guido. Go ahead and wave when I call your name. And we have our board treasurer from Ocular Insight, Marlene Day. And Justa's husband as a bonus. It's fine. So you guys, I'm so glad to have you here. I'm going to have you go around round table and I want to just have you share where you're from and just tell us where you are year-wise in your ocular melanoma journey. Justa, can I have you go first?
Yes, my name is Justa Guido. I am in Fresno, California, and I am 22 years post-diagnosis.
Okay, and Marlene.
Hi, I'm Marlene. I'm from Lillington, North Carolina, and it'll be 21 years in August out from diagnosis.
Okay, awesome. And Gayla, you're up.
I'm Gayla Timm. I live in Northern Virginia, and I am a little over 13 years out from diagnosis.
Awesome. Okay, so we've got everybody here. I love that we get to start with this question because I think that what it does is it gives all of the people who are listening who are new to this diagnosis, who maybe are getting all the bad news, right? Especially, I mean, you guys remember when you first get diagnosed, it's pretty grim. And I'm sure that for those of you who are 10 plus years out, it was even more grim feeling to get this diagnosis initially. So I love leading with hope, right? Leading with this idea that you guys are here. You're still here, despite all of the obstacles, despite whatever odds your doctor said you may have had when you were first diagnosed, you're still here. And I guess by, raise of hands, did any of you think that was going to be possible for you? Or is it just kind of like a surprise, like, oh my gosh, I'm here?
I mean, I guess I didn't know. I knew so little about it, and it was such overwhelming. But of course, the anxiety in the first 2 years, you were just I had little kids. And can we make it till his first birthday? Can we make it till they're 5? Can we make it till I'm 40? There was all these, things.
No, I totally get that. Jess, so what about you? I mean, you're 22 years out. I don't think I realized how far out you were. That's amazing.
Thank you. I was given a 50-50 shot. They were the odds I was given. And I had a small child at the time too. So it was, taken every day at a time. And once I hit that 10-year mark, it kind of got a little bit easier to cruise through. So it was shocking.
Yeah. And Marlene, what about you?
Well, my son was 23 at the time, and I thought I wouldn't see him get married or have grandchildren or whatever. I was a basket case. So now 21 years later, I have 2 granddaughters and he's married. And
I am going to have you guys talk a little about your initial diagnosis and just kind of elevator pitch your diagnosis to us, because I think it's important to illustrate you guys all have different stories, right? Everybody has different stories. You probably all had different sized tumors. Different things have happened, with your eye over time.
So mine is my right eye. I was actually very lucky of where my tumor placement was. It was on my ocular nerve. So I had interruptance in my vision very early on is what caused me to go in. So, and then at the same time, I was fortunate enough, I was working for the insurance company at the time. So they fast tracked the referral to the ophthalmologist through. So it happened, wham, bam, I was in there and they got a diagnosis. And I think part of that was the shocking part because it happened so fast. I underwent proton beam with Dr. Char in San Francisco. And it was just shocking. It was a very small tumor. I don't have exact sizes, whether that's got lost in time or just not given an exact size. But the radiation did sever the ocular nerve, so I don't have any vision, but I have my health. So,
well, that's huge. That's huge. And I mean, I'm sorry that you don't have vision. Speaking as a fellow right-eye diagnosed
yeah.
person who no longer has any vision in the right eye, it's a little disorienting sometimes,
Yes.
but I mean, we adjust, we get used
I'll
to
trade.
it.
I'll take the trade.
Yeah. No, I feel like that's something that I try to explain sometimes to people when they ask, because do you guys have this happen like that? And I'm sure you guys listening have this happen too, right? Like where you get asked all the time, like, how's your eye? And you're like 6 months out from treatment, 6 years out from treatment, however long it's been. And you're like, my eye is not what we're worried about anymore.
Right. Right.
Yes.
Oh my goodness. Yeah. All right. Okay. So Marlene, can I have you go next to just tell us a little about your initial diagnosis?
It took about 6 months to really get the diagnosis because I complained a lot. And my husband kept saying, oh, it's your bifocals. And I kept saying, I think this is more than my bifocals. And I went to the optician at Sam's Club, and he said, oh, I think you have macular degeneration. We're going to send you to an ophthalmologist. He said, but you're 46 years old. He said, you're too young. So I went to the one ophthalmologist and they didn't see anything. And then I still had trouble. Like I lost my depth perception. I lost the ability to go from outside to inside because my eye didn't adjust. So I'd walk into Walmart and stop. And then my husband would go, what is wrong with you? I said, I can't see. No one understands. I can't see. And I was getting upset. So finally I went back to the ophthalmologist and he said, sit down in the chair and cover your right eye and read the chart. And I said, okay, what chart? And he said, oh, you're not leaving today. You're not leaving. He said, and I went by myself. So that even made it, you're in the ophthalmologist for 4 hours, 5 hours by yourself, and we had a friend that worked at the ophthalmologist office. So he was there with me. So I call him my guardian angel. And I thank him all the time for being there, because if it wasn't for him, who knows how long after that it would have gotten diagnosed. They sent me to Philadelphia. I was diagnosed on a Thursday, Philadelphia on Monday, treatment the following Thursday.
Yeah. Now I know from at least speaking to really a lot of patients who've been treated in Philly, it happens pretty fast. If you end up in Philly, the treatment process is very rapid because Will's eye is so specialized for just treating, eye cancers. Ocular melanoma specifically comes up a lot. Okay. Well, Marlene, thank you. Gayla, do you want to go ahead and share your story?
Yeah. So I was diagnosed in 2011, late 2011. However, I first found the freckle on my eye in 2005. So I probably am somewhere between 13 and 20 years, really, in my, actual diagnosis. I have really bad vision. I always have pre-ocular melanoma. And I was visiting my dad in South Florida and was going to get LASIK done there. He had connections with, the people to fix my vision. And upon examination, they said, you have a freckle. Do you know you have a freckle? They said, I don't think we should do this. We're going to send you to a retina specialist. So I went to see a retina specialist in Florida. He's like, I don't think it's cancer, but you should continue to get checked. I lived in Chicago at the time. I was monitored in Chicago from 2005 to 2008. I was moving to Arizona in 2008. And I said to him, listen, you had said if this thing grows, we might need to treat it with a laser or radiation, but laser if it was small enough. And he talked to his colleague who was an ocular oncologist, and he said, no, I think it's okay. I went to Arizona, 2008 to 2011. I had my babies. Same thing. I went and got it checked. I think it was growing slowly, but I didn't realize it was different than a mole on your skin that, those can grow. Moved here, went to the ocular oncologist here in Virginia in November 2011. And he said, no, you're good. There's nothing we can do. But, if it gets to be over this size, then we would treat it as a melanoma. And so I left that appointment saying, oh my gosh, I'm going to have cancer. I didn't realize this. And I tried to call him back and say, like, my thing has been growing. Like, it's going to hit that number. And he said, oh, there's nothing we can do right now. Just, come back in 3 months or whatever. So I I forget. I think my mom's cousin is an ophthalmologist in Toronto, and her son-in-law treated ocular melanomas in Toronto. And so they said, you need to go to Philadelphia. You need to go get a second opinion. And so early December, I went to Will's, walked in on Monday, was the last patient there at 6 p.m. But they said, this is definitely a melanoma, and they had heard bad things about the doctor that I had seen in Virginia. They said, this is not the first time that you've had someone's been not diagnosed. And I was treated on Thursday. Same thing. That's their deal. They diagnose on Monday and they treat on Thursday. So yeah, mine was like a small tumor, borderline medium size, which of course I was super annoyed with at Will's. They treat you in like a pod. Like, I don't know, there might've been 8 people that got treated. And then we all went on the bus to the hotel to be like staying. Yeah. And one guy's like, mine's a pre-melanoma. Mine's a pre-melanoma. And I was like, oh, mine should have been a pre-melanoma. Like, it should have been diagnosed a long time ago. But anyway, that's my story. I had radiation plaque.
Okay. And just to clarify, Justa, Marlene, did you guys both have radiation? Like radiation plaque brachytherapy?
I had proton beam.
Okay.
I had plaque.
Okay. Yeah. And that, I mean, that's basically all that we had 10, 15, 20 years ago. It is pretty incredible to me that we even had brachytherapy 20 years ago, just knowing what I've learned in the last couple of years since I was diagnosed and how much science had advanced or has advanced in treating ocular melanoma. But it's pretty interesting to see that was kind of a universal experience for you guys as well, to just have some kind of radiation therapy, be it proton beam or brachytherapy. Gayla, you mentioned a really good point, and I want to highlight this. I think that all of us go through, I mean, I think the best way to describe it is really the grieving cycle. And you guys listening, like, hopefully you can relate to this. Well, not hopefully, like, you probably can, but I'm sorry you're part of the club. And what Gayla mentioned was this idea of, kind of like this, I feel like for me, it comes up as almost resentment and this frustration that, like, it could have been diagnosed sooner. It should have been diagnosed sooner. And in your case, like, because you had this freckle that was watched for so long, I mean, I'm just listening to your story, just going like, oh my gosh, for you and anyone else like you, like, I can't blame you for feeling frustrated and resentful of the process that got you to the point that you are, and that they let, something that was a freckle grow to be a medium large tumor. Like, how do you do that?
No, it was a large, small tumor, not a large. Yeah. It was like small.
So like large size or on the large end of small.
Yeah.
Okay. That makes me feel a little better.
Yeah. It hadn't gotten that out of control. But the Virginia specialist that I saw, I said, oh, well, could you treat it with a laser? And he goes, oh no, it's much too big to be treated with a laser. Whereas in Chicago, he had said, well, we could treat it with a laser. So I said, like, well, what happened? How did we go from laser treating size to now it's too big to be treated with a laser?
Oh, yeah. Yeah. So, I mean, I want to just highlight, what are some of those emotions that you guys can remember feeling? And it can be emotions that you still feel, because I think it's important to highlight that, I mean, I'm 4.5 years into my diagnosis, and I still resent some of the situation around what led to my diagnosis. I still have those feelings of regret or, wishing that it could have been different come up. And I think that it's important that we validate that that's normal. So, Justa, Marlene, who would like to go first by raise of hand? We're just going to talk about feelings, guys.
Yeah, I'll go first. I don't really have any resentment as far as that part went, because I did find it so early. Like I said, because it was messing my field of vision up, it was very lucky. I think my resentments came a little bit later because I was so young and I was going through an ugly divorce at the time too. So my daughter was with her father a lot, and she was like 7, and he kept telling her I was going to die. And so I have a lot of resentment around that with her. And she and I talk about that to this day, because of course she's grown and I'm still alive. And so she has a lot of post-trauma with that. So I have a lot of resentment with that. And with because I didn't know at the time, is this going to affect my other eye? Am I going to lose my vision completely? Am I going to get to watch my daughter grow up? I had so much emotion in those first several months of taking in everything around me to try to memorize. I just remember thinking, am I going to get to see this sunrise? Am I going to get to see that flower? Am I going to get to see my daughter in this parade? And just committing everything to memory because I didn't know. And so those were the feelings I struggled with early on. And then if I was going to live to see another day, those were the feelings I had. And then the doctors surrounding it were very cut and dry. There was no bedside manner. I don't know if anybody's met Dr. Char. He's a wonderful doctor, but his bedside manner is not the greatest. So he's very, very cold and cut and dry. And the ophthalmologist who discovered the tumor looked at me just very bluntly and said, "How long have you had that spot in the back of your eye?" "I don't know. I've never had my eyes dilated." He goes, "Okay, well, I think it's a tumor and we're going to send you to San Francisco." And he gets up and walks out. And like, he kind of just left me there. And mind you, I had just lost my dad to cancer a year prior to this. So the C word was very like, traumatic to me. So all of those emotions were what I struggled with. So I think we all deal with different emotions, with how you're diagnosed, with how you process it, all the things, getting a cancer diagnosis in your 20s shouldn't happen.
No, I mean, yeah, I mean, I agree. I agree. And I think you highlight a good point too, with like just the bedside manner and how doctors deliver this news. It really does affect our journey as patients. And I'm glad that you brought that up. For those of you guys listening, make sure to watch the next session because we do have an ocular oncologist, Tara McConnell, who is going to come on and talk a little more about this. And anyway, so Marlene, what about you? I know you mentioned you had a son who was 23 and there was a lot of fear for you. But what else was going on?
The frustration because I struggled with the vision between making the doctor's appointment and getting diagnosed. Just I had a feeling I was losing my vision, like I just by things that was happening. Like I'd go to write on a piece of paper and the lines would disappear, and I kept saying, "I'm losing my vision. I'm going blind." And my family kept saying, "No, you're not." Until we got the diagnosis. And I left our ophthalmologist office in tears. And I have a twin sister. So the first thing I did was call her. And so that was an emotional part on my end. That was my security, was to call her. And I still get emotional to talk about this because it's been 20 years, but it's still there. Am I going to watch the grandchildren grow up? That bothers me too. But more so today, like I'm emotional today because I knew this was going on. And so it's in the back of my mind all the time. And everyone keeps saying, "Well, you look good. We can't tell you don't have vision in your eye." Well, it took me 20 years to adjust to that. Every year was a little bit more. I got adjusted a little bit more. But, my husband walks on my left side because the vision's gone in the left side. I have him pretty well trained to be my guide on my left side, and stepping off of curbs, he's like grabbing the hand. Sometimes I don't want that, sometimes I think, "Oh, I'll do it." But, it's still there.
I mean, I think we all go through phases, especially if we've lost some degree of vision where, we're kind of in a little bit of denial of like, "Nah, I don't need help. I can do it myself.
Yep.
I'll figure it out." And I kind of challenge myself sometimes even with this idea of like, well, can I do that with one eye? Like, I don't know. I haven't tried it yet. Like, let's try. But at the same time, like, I just want to honor you for just highlighting, I think probably what the most, or what the majority of us deal with, which is the grief, right? There's a lot of grief around a cancer diagnosis. And if you guys have heard any of our other like mental health seminars, we've talked a lot about the process of grief. We've had another patient, Carol McCall, who's a therapist, and she's talked about grief. We'll have another patient therapist, psychologist. She's our last presenter for today, and she's going to talk about just some of the therapy things that we can do to support ourselves as patients. So I do want to ask you guys, have you, over the last, I guess, 10 to 20 years, ranging for each of your diagnosis times, have you guys sought any support for navigating your mental health, for, just emotional support, to help you process everything that you went through? And if you did you find it helpful? If you didn't, then what do you feel like has helped you to process all of this? Because I think we've all done a lot of processing. Gayla, do you mind if I call on you first?
No, not at all. Yeah, so my life's a little bit complicated also. When I was diagnosed, I had a 10-month-old son and a 2.5-year-old daughter. And my 2.5-year-old daughter around the same time, it was becoming very clear that she was significantly developmentally delayed, and so she has pretty severe autism and intellectual disability. So it's another big challenge and stress in our lives. And so yes, between the anxiety of the cancer diagnosis and wondering, like, my little baby boy was 10 months, like, is he going to remember me? Am I going to be here for his first birthday, his third birthday, his fifth birthday? How long do I have to be here for them to have memories of me, right? Because they were like my world and I loved them more than anything, and I just wanted them to know how much they were loved by their mom. So yes, I had a lot of therapy at the beginning, and I'm freely admitting I've also been like on SSRI since the beginning. And I don't know what when I was first diagnosed, I had major anxiety. I mean, I think I was taking SSRI and maybe Tylenol PM and Ativan to sleep for the first couple of months. I mean, I just needed to like shut the world out. Right. And so as time has gone by, my anxiety and issues are more dealing with my daughter than ocular melanoma, but I still get scans. And, around that scan time or the results of what's on that report, sometimes they're not cut and dry and clean, and there's, something alarming. And so, yes, I still speak with a therapist, every few weeks. And I still, when it's scan time, we still, go through that process of trying to, not get ahead of ourselves, live in the moment and not, don't exaggerate things, just take what we know. And yeah, it's been a really challenging time.
Yeah.
But I'm thankful for those, resources. And I don't take the Ativan anymore for the Tylenol PM, but I mean, I still take Lexapro and, to help manage my anxiety.
Well, I think it's really important to highlight that and just to normalize that for, that's what's been helpful for you. And so if that turns out to be helpful for someone else who's listening and you seek that kind of support from a psychologist, psychiatrist, having a therapist, any of those things are okay. Like, it's okay to need that, to want that.
Yeah.
I have therapy every week. I have therapy every week right now, and it's a huge help for me. And I'm also a mom of young kids, and I have my kids in therapy, at least the two oldest kids, because I have seen how this has, contributed to developing anxiety in them and exacerbating and, just making it worse in terms of maybe just normal kid anxiety about different things. Like, they have a lot more of it because of all of the things they've watched me go through in just 4.5 short years. Okay. And I also want to highlight that if you haven't had therapy and you're listening, it's okay. It doesn't mean you're doing something wrong. We're just trying to demonstrate kind of the journey here, and that this can it can look different for everyone.
Can I just add in also that although I have good friends, right? Friends don't always know how to respond. And so for me, they just want to be cheerleaders and be like, everything's okay, you're fine, right? Whereas you needed somebody to really acknowledge those anxiety feelings, right? And so that's where a therapist was really important for me.
I love that. Thank you, Gayla. Justa, can I call on you next?
Yeah, absolutely. I had not had any type of therapy to deal with it. I kind of just had a good support system at the time with family. And as I said, I was going through a divorce and had eventually remarried, and he at the time was wonderful. Not my current husband. We've moved on from that. But everybody in my circle was just so supportive and so wonderful and helped me process it. So I don't know if it didn't feel a need or didn't have the resources at the time. I'm not exactly sure why I didn't. Looking back on it, I probably should have. I don't have scans anymore. I stopped pretty much at like the 10 to 12 year mark. I still see an ophthalmologist annually and have liver panels done annually. And so those kind of things cause me anxiety, but I don't do anything past that. I kind of relinquished after so many years of having everything be clean and having everything. They told me your tumor's dead, you're good. And they probably shouldn't have told me that, because then it kind of gives you a false sense of security. And I know it can kind of always be lurking there, but I've relinquished to it. I'm like, okay, I'm going to do my annual things. I'm going to live my life. And I didn't want to be consumed by it, because I was fortunate enough to not have to be.
Yeah.
So kind of that's how I've dealt with it mentally.
No, like, don't give cancer more time and
right
and space than it deserves.
It's very good way to put it. Yes.
Well, I think that's so good to highlight. And I'm glad that, I mean, like, I hate to put you on the spot, but I'm glad that of the four of us so far, that you're, the first one to say, like, oh, yeah, like, I've never had therapy. Like, I think that's okay. I think there are some of us who we manage well. We do have a good support system. But
Right.
I also think it's really important to acknowledge, like Gayla said, that sometimes your friends can't quite do what a therapist could do, or
Right.
what,
Exactly.
somebody who can provide that mental health support.
Mhm.
Marlene, what about you? You've got this beautiful sunbeam behind you. I'm like, oh,
Yeah,
glowy.
it's sunny today. It's warm today. I did see a therapist right after because I went to my family doctor at the time. We still lived in Pennsylvania at the time. He said, well, you just had a major life change. He said, so, seeing a therapist would probably be a good thing. So I went for a little bit but I had a lot of family support and friends support. And after the original diagnosis, they finally came into the realm of things that I do have cancer. And I was the first one in my family to be diagnosed with any cancer in my immediate family. So that was a hard on all of us,
Yeah.
for that reason. And to have such a rare cancer. They're
Mhm.
like, well, how'd you get, my mother was 80 something. And she's like, well, how'd you get that? Well, I don't know.
Like, I wish I could tell you.
Mhm.
Then every time I saw her after that, she'd go, how's your eye? Well, it's not going to get any better. I don't have vision. I lost my vision in my left eye. And, but every time we would see her, how's your vision? And it is what it is, and
Mhm.
I still get scanned. My family doctor said it was up to me and she would do whatever I wanted to do. So if I change my mind, then, but I only get an ultrasound. I get an ultrasound and I get my chest x-rays and I get the blood work. So,
And
and I
Gayla,
still see the ocular oncologist yearly.
yes. Well, and I mean, raise of hands, like, we've had the diagnosis in one eye, and I know that, I mean, just talking to countless ocular oncologists, that it's so rare for it to ever happen in two eyes. But like, raise your hand if you still have the fear that it could show up in the other eye.
Mhm.
Like, absolutely 100% something that I'm, every time my vision in my right eye or my left eye now changes in any way, it's like, ooh, should I go see?
Mhm.
Should I go see the doctor about that? So I mean, I think what we're highlighting here between the three of you, and even, even just in someone like me who's kind of a baby in the diagnosis journey, like 4.5 years in, like, we all deal with some very similar anxieties. And the scanxiety, the, having the doctor's appointments, having the blood work done, any of those things that can introduce that potential for something to change. Right.
Mhm.
And Gayla, I love that you talked about like the scans and how sometimes you get kind of confusing things on the reports. That, sometimes, and I've learned this from my doctors, that like the body changes every day. And an MRI of your liver or an ultrasound of your liver, it's a snapshot in time, right? The blood work that you have done every year or maybe every couple months, whatever your scans and your surveillance looks like, it's a snapshot in time. It
Mhm.
doesn't mean your doctor doesn't look at it critically and they don't like look at it and go, what does this mean? Is this something we need to be worried about? But it is still just a snapshot in time. And so that's kind of what I try to reassure myself of, but it's easier said than done sometimes.
Yeah.
What helps you guys like in navigating the scanxiety, or just really, I guess, surveillance is a better word, because I know, Justa, you don't have scans anymore, but you do have blood work.
Mhm.
So when that anxiety comes up, what are some of the, maybe the techniques or the strategies that you've kind of developed a habit of helping yourself to cope with that? Anyone want to go first?
I'll go first with it.
Okay.
I don't deal with it very well. I had not even a regular scan. I had some blood work for something else going on. We'd traveled to Mexico and we came home and I had just this awful stomach bug that I couldn't shake. And so they did all kinds of blood panels at the time, and all my liver stuff came back like crazy high, like
Oh,
high as it's ever been.
Mhm.
And I completely melted down. Like, this isn't supposed to be, we're not even looking at this right now. Why is this? So I called my doctor, and it was just my regular doctor. Like, they don't follow me for this. It was, it was not supposed to be like this at the time. And so I explained to them, you don't understand this, my liver enzymes can't be this high. And she's like, okay, well, let's rerun them. Cause I was on vacation, another vacation at the time I got those results back. I was on a rooftop bar calling in to get these results. She says, let's not panic. Let's rerun them and see if everything settles back down. And they did. So they couldn't explain if it was a fluke, if it was my body reacting to whatever virus I had, but it still freaks me out. So I don't deal with it very well when something goes wrong. And probably in hindsight, it's because I don't have the scans and I don't have a full image of everything. I take care of my health in every way possible. You know, physicals and everything else, but it's still always going to be in the back of my mind that something's going to go wrong. So no, I'm not the one to say, how do I deal with it? Because I really don't. I melt down and then I get past it.
Hey, the only way through is through.
Right.
Marlene, what about you?
Well, right now I'm panicking because I go see Dr. Madarin in 2 weeks. So, you know, for the ocular oncologist appointment. And so I'm trying just to keep busy. I watch my granddaughter, so she keeps me pretty busy. So it takes the tension off of me, you know, at that point. But I only get upset if they come back with a result I don't like. You know, like last year when they found on the CT scan, they thought they found something on the pancreas. So, you know, that put me in panic mode. And then they wanted to do the MRI, and I'm going, okay, but I'm allergic to the dye. And she goes, well, we have to do a contrast. And the hospital here uses a water. I've now had the EVIST contrast, but I had a water-based contrast, which I didn't have a reaction to. So now I know that when I go and they say we need an MRI with contrast, I can say, I want water-based because I had a severe reaction to the MRI dye once, and it wasn't water-based. But other than I just wait till I get the results back, and then if I have to panic, I panic. If I don't, then, you know, I think I convinced myself you're 20 years out, you know, just.
Yeah. I mean, easier said than done sometimes. I think it's important to validate, you know, we've got to give ourselves space to feel what we're feeling and for it to be real and for it to be normal. And that, you know, there's nothing wrong with you for feeling those feelings, even if you are 20 years out. And especially if you're, you know, 2 years into this, like if you're brand new, if you're newly diagnosed and you're listening and you're like, oh, I don't know how to do this for the rest of my life. Like, I mean, I get that feeling sometimes of like, how can I keep doing this for another 20 years? Like, I want to be here in 20 years, but how can I do this? Because this is exhausting sometimes. Gayla, what about you?
Yeah, so I think, you know, I hear Justa say she's not doing scans anymore. And that's something I don't think I'm ready to do that. But the scans still cause so much anxiety, right? And so you're looking at it like, okay, I'm 13 years out. So for example, a year and a half ago, maybe, something was found on my liver MRI that they said, we're not sure if this is a cyst. We don't know for sure. So Dr. Sato, I see in Philadelphia, had said, well, you might be able to move to every 2 years. So suddenly it's like, okay, you got to get rescanned in 6 months. So then I get rescanned in 6 months. I see him. We have the preliminary report from the resident, not the attending, you know, of the MRI. And he says, looks like a cyst. You're good. Come back in a year. Well, like a month later or a week later, I just log into my chart and there's the final report from the attending. And it said, like, we cannot say this is a cyst. It's a possible stable metastases. And so like, I like fell off my chair. Like, what? Like a big word to throw around. And so I, you know, of course I call the office, and his nurse Erin was like, so I'll talk to Dr. Sato. And Dr. Sato was like, I think that was an inappropriate word to use. I think it's a cyst, you know, but now suddenly I'm in this panic mode thinking, I'm okay, I'm fine. I deal with my scans, right? And now it's saying possible metastases. So I went 3 months later, and then that report said it looks like a cyst. And then I went another 6 months later, and they say it looks like a cyst. So now I'm back off that roller coaster, right? But it's like, what are the odds of it actually being something versus the stress that the scans can cause, right? Because like you said, they pick up on all these different things that may or may not be something, right? And I've looked at all the images with Dr. Sato, and he's like, it's just really hard to tell when they're tiny. You really don't know what it is, right?
Which is never a good feeling when your doctor tells you, you just don't know.
And doctors are very like cut and dry. They're like, well, we'll look again in 6 months. We'll look again in 3 months.
You're
when am
like,
I
but that
supposed to do
doesn't
that
feel good.
information? Right. And I think it's spilled, like Justa said, into other parts of my labs and things. Like I think I have something going on with my parathyroid right now, and maybe my thyroid, right? But then I see the report and the doctor says, like, well, we see this, like, you need to do the next scan. It's just there's no emotion. Like,
Yeah.
it's just, and you're like, well, what does that mean? Right. Or I had uterine polyps, and I'm like, well, do you think they're related to the melanoma? And she's
Yeah.
like,
Right.
No,
or
it's
I had a
always a
uterine,
question,
right?
right?
Right. And she's like, no. And I'm like, well, how do you know that? Like,
Uh-huh.
it bleeds
So
into all the other parts.
can I just make an observation? It sounds like what you do is maybe similar to what I do, where you ask for more information, right? You get as much information about what you are seeing and you're questioning it. You're trying to get as clear of an answer as you can. And just, I think you do the same thing. I would probably argue, like Marlene, I think we all do this, right? When we get something questionable in a report from a scan, or our doctor just is like, oh, we just need to keep watching this. Like, we'll just watch and wait for a little while. The anxiety is there. And one of the ways that at least all three of you sound like you've dealt with that is to seek more information and to push for that information and to advocate for yourself that you need that sooner, and to share why, right? To share the scariness of our diagnosis, and to share like that, oh yeah, like it's not okay for my liver enzymes to be up, because if my liver enzymes are up and they stay up, then that means that my liver is having a problem and we need to address that. Like, and so that, but like you said, your family practitioner doctor doesn't. And because they're not the one who monitors for uveal melanoma, like
Right.
I can imagine you guys being so much further out and maybe not being as regularly monitored or as frequently monitored by a uveal melanoma specialist. I can
Right.
imagine your anxiety even now is maybe a little bit worse because you're not in the immediate hands of someone who could just take you from here to there and know what to do next if there is something to treat. And it's scary too, because there's just those crazy stories of the people 15 years later who metastasize, and it's like you think that they would have been fine. So like, I mean, I'm so glad you guys are all here, but I wanted just to highlight like one of the ways that it looks like all of you guys are coping with some of this anxiety. Marlene mentioned distractions. Like I definitely am. I live in the world of distraction, especially when I'm waiting for results. Like I have to really avoid some of those things. I do want to ask, as we're kind of ending the last like maybe 10 minutes of our session, do you guys, whenever you have a scan or you have a report of some kind to look at, do you guys prefer to look at it with your doctor, like at the same time in a follow-up that happens, and the first time you see that report is with the doctor? Or do you prefer to look at that information way before you even meet with your doctor? Days, a month, a week? I don't know how the follow-up schedule works for everyone, but what's your preference? Justa, I can see you like nodding like a no.
any kind of anything I get, like, I heard Gayla mention my chart. My chart's a blessing and a curse, because you get your information in there, and then my husband always tells me, stop looking things up, stop. And I'm like, but I can't help it. But I have learned, because as we learned through this whole journey, you have to be your own advocate. And if you're not going to ask the questions, nobody is. Unrelated, but always going to be related. I had some spots come up on my mammogram, and I had to go every 6 months. And I loved how they worded it in the report. Probably benign. I didn't like that word. Probably benign. I didn't like that. I didn't like that. So I seek the knowledge. I drown myself in it, and then I overanalyze it, and then just to be told it's all fine. But I think that's a coping mechanism.
It's a very normal coping mechanism. It's a grasp for control. That's what I do. I absolutely do that. I grasp for control in anything that I can. And when I can't find it anymore in my diagnosis with whatever is going on, then I start to seek it in other things, like other problems that I can fix, a project at home, some like it's very easy to find new problems for my brain to try to solve.
Yes.
Anyway. Okay. So, Marlene, what about you?
Well, when they found what they thought they found on the pancreas, she called, like my primary physician called, and she said, we need to schedule an MRI. Like I didn't even get to the my chart. She called first, because she said, she said, you are your best advocate, is what she told me. She said, and if you read that chart, you know something. So she called me and we scheduled it right away. So, which I really like her for that, because some doctors don't, they let you read the chart first, and then you call them, and but she does. She calls.
Yeah.
She'll call right away.
Oh, yeah. Everybody's doctors approach it differently. Everybody as a person approaches it differently. Gayla, what about you? I know you mentioned my chart. So do you go looking or?
I don't like that my chart releases things now. They didn't when I was first diagnosed. The doctor had to release the MRI. But I've always had anxiety with waiting. So I had a great lineup for years in Philadelphia where I would get scanned on a Tuesday. I would see Dr. Sato on Wednesday, and they would have at least the preliminary report. But now and so they would give it to me. But now it's taking a week plus to get a report. So I can't do that. I have to schedule the visits separate. I go up to Philadelphia to get scanned, and then I go back up to see them. So I do check it. But Dr. Sato and his team, Aaron Sharp Mills, the nurse practitioner, they are very good with us. And so as soon as I open it and I read anything, I'm calling Aaron or I'm messaging her, and she'll call me and talk to me. And so she'll give me the feedback I need. And I can reach out with anything. Like with this, I said my parathyroid. Well, that means high calcium levels, but in the blood. But before we knew it was the parathyroid, right, that could mean like cancer in the bones. And so I called Erin immediately. She's like, it's not ocular melanoma. I can't tell you it's not cancer, but it's not ocular melanoma. So I really like that team is there for us to provide the support and information we need in real time. And she knows I can't wait 2 weeks between scanning and getting a report.
Yeah.
So my husband, though, same, Justa, is like, don't read it. Don't read it. Wait till Dr. Sato talks about it with you. And I'm like, I can't. It's just sitting there. It's in my inbox. I have to press it. I can't not.
It's like the button that you have to push it because you're being told not to.
Didn't release it.
Yeah.
I really wish they didn't.
Yeah. So, and I'm going to just jump in here just to offer two things. Number one, if you're listening and you're hearing about Philadelphia, right? Philadelphia is a wonderful place. I am not at all discouraging you to go to Philadelphia, especially if you're very close to Philadelphia, but please don't hesitate to look elsewhere around the country because we do have some really wonderful teams, both for treating ocular melanoma in the eye, all around the country. We've got all the way from San Francisco, where Dr. Prithvi Murthyunjaya is, clear over to Philadelphia with Carol Shields. Like, we have some really solid ocular oncologists all across the country. And if you are looking to find a really good expert, there really are many of them. And the other piece of it is that for uveal melanoma medical oncology, so that's a uveal melanoma medical oncologist, that would be the person who is running your scans. They're doing your blood work. They're watching the rest of your body. If you are also hearing about Philadelphia and thinking, oh, I should just go to Philly, please consider trying to find someone close to you. It's not that you shouldn't or couldn't go to Philly, but try to find someone close to you. Save yourself the travel, save yourself the extra anxiety of having to have a doctor that's out of state if you don't have to have that. If you're on the West Coast, like we've got Seattle has a really good base. We've got California has a few really good centers. Arizona, where I live, Dr. Moser is incredible and his team is so good. For that little soapbox there, please look around and find the people who are there and ask for second opinions of people that live closer to you if you need them.
Yeah. And I was diagnosed, a long time ago. So there was less options then. And Philadelphia is only 2.5 hours from me. So it just made sense. But even with that, I don't see the Shields anymore. I now go to Hopkins in Baltimore, which is closer for my eye surveillance.
Okay. And then the other piece that I was going to say is that I think Gayla and I have a pretty similar experience with our doctors, our medical teams. And so I have the Honor Health team out here at Scottsdale, and they're very similar in the sense that, yes, my chart result is there, but if I have questions, I can email my doctor and the team, and they will get back to me right away with some level of reassurance, or they will, in some cases, move my follow-up up so that, it's not a week out, it's maybe the next day. Sometimes they're able to just give me a quick phone call. Like, there are ways, especially when you're letting your doctor and your team know what you need to feel better, or just to feel a little more secure in navigating something very uncertain, they will do that for you. But if you don't tell them, you don't communicate that in some way that that's what you need, they can't read minds. So advocate for yourself, learn what you need, and start asking for it. And if one time you try opening your MyChart result without your doctor and you're like, oh crap, nope, that was a bad idea, I'm never going to do that again, then you've learned, right? Now you know to wait to talk with your doctor. I'm someone who has gotten the results with my doctor for the first time and freaked out in the office with them instead of having, like, I prefer to look ahead of time, because if I'm going to have an emotional reaction, I would rather be emotional before I meet with my doctor. And that's just something that I've, a strategy that I've worked through to understand that, okay, I cope better with good news or bad news if I find out first and feel the feelings and then talk to my doctor and make a plan. Because I would rather spend that time having him help me make a plan than having him try to be my therapist, because he's not my therapist. So anyway, just food for thought. Okay, well then to end, I want to end with one of my favorite parts, and this is where I want you guys just to share, one sentence. I won't limit you to like one single sentence, but just share one thing that if you could share this with anyone who's newly diagnosed, somebody who's new to this diagnosis right now, maybe they're newly metastatic or any of those things. What's one piece of advice that you would share with patients?
Yeah, so this is definitely something, and I feel like I've focused on the negatives throughout this, but one positive for me that has come from this has made us learn to live in the moment, to enjoy the year you're in. It's not about, well, when I get married and when I have kids and when I have grandkids and all these things in the future. It's about, I'm in 2025. What am I going to do this year that makes me happy? What are my goals right now? And I know like we have friends who are like, oh, you guys travel so much. I mean, we're going to travel when we retire. I'm like, well, good for you, but I don't know if I'll be living when, we retire. So we're going to travel now. And if we get to travel again next year and in 10 years, then that's great, So the diagnosis really helped me be more thankful for what I have now and to be able to really enjoy those moments now.
That's beautiful. Thank you, Gayla. Marlene, do you want to go next?
Yeah, I just reach out to the groups too. Like we have Facebook pages, and there are a lot of people that will help. And when I got diagnosed, there wasn't.
Right.
We didn't have a support group. We didn't have anybody to talk to other than my friends and, and nobody knew, like, what is it? So I would say reach out to any one of us. And
find the support, find your people, right? We do exist.
Yeah.
Justa, what about you?
I kind of caught the last of Gayla's statement she made because it kind of froze up on me, but I think we have the same as live in the moment. It's corny because it's a cliche, but you have to live like you're dying every day anyway. And every day is a gift. And I've learned that because I lost both my parents young, of course, having a cancer diagnosis young. You don't know what tomorrow holds. And so live for today and enjoy and be thankful for it.
Yeah, it's beautiful. Well, you guys, thank you for listening. Thank you guys joining us live. I'm so glad that we've had our group here and our panel. You guys have had some incredible insights and have just shared really, I just feel like really real experiences. And so I hope that those of you guys listening, you can take away from this and just know that you're not alone. And like Marlene said, reach out to us. Find us on Facebook, find us on social media. Please reach out to Ocular Insight. We do have a Zoom network. Sorry, not a Zoom network, a Zoom support group. It's every Tuesday night at 7 p.m. Eastern. There's a metastatic room and there's a regular, like just normal oncology, ocular oncologist, like you're newly diagnosed for your eye. So if you have questions, if you just need to talk with someone who is a fellow patient just for the day, just for the night, like then know that that is a resource that is there for you. The board of Ocular Insight, Melody, and the rest of the board, they are really, really very good at making sure that this Zoom support group is there for patients to support each other like all year round, barring a couple of holidays. So, there's 52 weeks in a year. That's roughly 50 of the Zooms that you can attend. And you can have this weekly support where you just talk with other patients. And the patients that are on there are really, they're very compassionate. And I think that we're all really very capable of supporting each other. So definitely take advantage of that. And I just want to say thank you again to my panelists, to Gayla, to Justa, and to Marlene. Thank you so much for being here, you guys. Let's go ahead and say goodbye, and we'll see you guys in the next session.
Thank you for having us.
Thank
you.
Everybody.